My name is Joel, and I live with bipolar disorder. Back in the 1970s, doctors at a large American mental hospital decided to try an experiment. There was this new medication used to treat bipolar mania in Australia called lithium carbonate. They didn't have many manic depressives, or so they thought. But they went ahead and dosed their entire population of schizophrenics just to see what would happen. Two-thirds of them got well enough that they were discharged. American doctors learned two things. First, they had to take a hard look at their diagnostic procedures. And second, they had a powerful new drug that didn't have the intense side effects of other medications used to treat bipolar mania, such as thorazine, an infamous chemical straitjacket that made patients drool and shuffle about like zombies. Lithium, let us go home. Think about that for a moment. I am here and not in a mental hospital because of the legacy of this experiment. Though I am on another mood stabilizer, the success of the lithium experiment affects me even today. It has led to a revolution in psychiatry. Instead of being locked away, I get to live outside hospital walls and have a productive life. I am free. I take a mood stabilizer called carbamazepine or Tegretol. It is a mood stabilizing anticonvulsant, which means it works for both bipolar disorder and epilepsy. I've been on it since a disastrous summer of medication changes, which ended in the fall of 2008. Carbamazepine makes me feel clear headed. The only side effect that I have to worry about is a low white blood cell count. My endocrinologist and my hematologist keep tabs on that for my psychiatrist, and for 7 years, the numbers have been good. It does the job for me. I don't suffer like I used to from mania and mixed states. Without the manias, I don't crash into catastrophic depressions. Unlike the atypical antipsychotics or Depakote, carbamazepine doesn't make me gain weight. I learned through experience that carbamazepine does some other good things for me. It also works to relieve my nerve pain. A few years ago, I hit my elbow. My arm went numb down to my little finger and half my ring finger. Just the side of the ring finger was affected. Doctors doubted I really hurt myself. Until I got to a neurologist who looked at my formulary and said, "Ah, you are on carbamazepine. That's why you're not feeling any pain." It doesn't work like that for everyone, but I have found that it also tames the symptoms of my migraines. It is a good drug for me in many ways. Now, don't go running to your doctor to see about getting on carbamazepine because of my story. Tegretol doesn't work for everyone. Not even lithium, which is the gold standard for treating bipolar disorder, helps all patients. The rate is 70%, which means that approximately 1 in 3 people gets no relief from it. I have to emphasize that your job as a patient is to be, well, patient. You've got to try the medications for yourself, noting what side effects they have and how well they control your symptoms. You have to be honest with your doctor, but you also have to take your place as a member of the team. I don't advise noncompliance every time you experience an unpleasant side effect. I know one fellow who stops his medications every time he feels a tinge of nausea. But sometimes you do have to stand up and tell your psychiatrist that the medication is not for you. And you have to conduct honest trials. You have to take the pills so that you can see how well they work for you. The next time you think about stopping your mood stabilizer, remember the bad days. Remember the depressions that came after the manias. If you are one of the lucky ones who didn't crash, remember the pain you caused those who were closest to you. They felt your rages. They suffered with you when you spent all your money. And they cringed when you had affairs. If you won't do it for yourself, do it for them. And remember the days that came before, when they put people like you and me in mental hospitals and forgot about us. Look at these pictures. Any one of these people could have been you. Trust me, you don't want to go back. Remember, mood stabilizers let us go home. Hold on. Hold on. Hold on. Bye.